Assisting catheterization by Mahina, Rachel, and Becento Mercer. We have first straight catheterization. Definition: it is assisting in the introduction of a catheter into the bladder to the urethra for the relief of urinary retention or for emptying the bladder completely. The two types of catheterization. First, intermittent or the straight catheterization. Single use of catheter is introduced for a period long enough to drain the bladder 5 to 10 minutes. Second, the Foley and dwelling catheterization remains in place for an extended period until a client is able to void completely and voluntarily. May be necessary to change catheters periodically. Types of catheter. We have a straight catheter, has a single lumen with a small opening about half inch from the tip. Second, Foley catheter has a small inflatable balloon that encircles the catheter just below the tip, has as many as 2 or 3 separate lumens within the body of the catheter. 3. We have a cloud catheter, has a curved tip used on male clients who may have enlarged prostate with obstructions along the urethra. For equipment, straight catheterization tray, we have straight catheter, we have sterile gauze bowl, sterile towel with hole, sterile gloves, antiseptic solution, the jelly, sterile forceps, flashlight, sterile specimen container, flashing tray, bed pan, and that's it. For preparation of equipment, obtain treatment card from the nurse and check with doctor's orders. To save time and effort, bring equipment to bedside table, checking light source. Preparation of the patient. First, identify patient and explain the procedure and need for the patient to keep knees positioned during procedure. Describe pressure sensation that will be felt during catheter insertion. Rationally, patient will feel reassured if the procedure is explained and if she is handled gently and considerately. Of course, screen the patient to provide privacy, reduces client embarrassment, and aids in relaxation during the procedure. Place bed in high position and lower side rails at working side. Promotes use of proper body mechanics. For proper body mechanics. 4. Place patient in dorsal recumbent position for female and bring knees up and out and may need assistance to keep knees in the position for male. This position provides for good visualization of the urinary meatus and perineal structures. Next, drape the patient with top sheet. Assist patient to side near you. Loosen foot part of the top sheet. Use diagonal draping. Male expose only the penis and a small surrounding area. To expose perineum and avoid unnecessary exposure of body parts and maintain client's comfort. Provide perineal care if needed. Presence of microorganism near urethral meatus is reduced. Place tray between thighs facing foot of the bed. Provides easy access to supplies during catheter insertions. Adjust drop light, flashlight may be used, permits accurate identification and good view of the urethral meatus. Place waste receptacle at an area near you and wash hands for asepsis. Open stir pack. A. Grasp it corners and open it with care, touching only the undernet and sides and edges. Bring edge of cover under buttocks if able. Rationality provides sterile field and to prevent transmission of microorganisms from table or work area to sterile supplies. Let the doctor open the pack of the sterile gloves to put on gloves. Allows doctor to handle sterile supplies without contaminations. Observe sterile technique in offering pack of towel and with hole draping to maintain sterility. After that, place adequate amount of lubricant over the non-dominant hand after the doctor cleanses urinary meatus. Allows easy insertion of catheter tip through urethral meatus. Next, pick Foley catheter. Size according to age. Remove outside pack, observing sterility. Ensuring the tip of the catheter will be offered for lubrication and insertion. Outside pack is unsterile. Doctor will pick the tip of catheter for lubrication. Instruct client to breathe through the mouth while doctor inserts catheter to the urinary meatus. Relaxation of external sphincter aids in insertion of place distal end of catheter in sterile valve to be sure urine volume or attached to drainage bag as indicated. Collection of urine prevents soiling of client's bed, linens and allows accurate measurement of urinary output. Collect urine specimen if needed. Fill sterile specimen container to the desired level by holding end of catheter over the specimen bottle. Allows sterile specimen to be obtained for culture analysis. After that, the doctor removes straight single-use catheter slowly. Discomfort to client is minimized. Remove drapes prevents transmission of infection. Next, position the patient for comfort. Put the bed in low position with side wheels up. Promotes comforts. Discard equipment in the utility room prevents transmission of infection. Lastly, wash hands thoroughly to reduce spread of infections. For indwelling catheterization, follow steps of straight catheterization from numbers 1 to 17. Offer 10 cc of syringe filled with distilled water to the doctor to inflate inflation balloon. Inflation a balloon anchors catheter tip in place above bladder outlet to prevent removal of catheter. Attach end of the catheter to collecting tubes to drainage system and list already connected to bag. Place drainage bag in a dependent position. Rationally, close urine drainage is established. Dependent position of drainage bag promotes flow of urine away from the bladder. Next, tape catheter. Female client, tape catheter to the inside of the thigh with strip of non-allergic tape. Allow for slack so that movement of thigh does not create tension on catheter. Rationally, anchoring of catheter minimizes trauma to urethra and meatus during client's movement. Catheter position over the thigh prevents kinking. Not allergic tape prevents skin breakdown. For male client, tape catheter to top of his thigh or lower abdomen with penis directed toward abdomen. Allow for some slack in catheter so that movement does not create tension on catheter. Rationally, anchoring catheter to lower abdomen is thought to reduce pressure on urethra at junction of penis and scrotum, thus reducing possibility of tissue necrosis in this area. Be sure there are no obstructions or kinks in tubing. Place excess oil coil of tubing in bed and fasten it to bottom sheet of clip of drainage set or with rubber band and safety pin. Patent tubing allows free drainage of urine by gravity and prevents backflow of urine into bladder. Assist client to comfortable position. Client's comfort and security are maintained. Instruct client on ways to lie in bed with catheter. Side lying facing drainage system with catheter and tubing draped over lower thigh. Side lying facing away from system catheter and tubing extending between legs. Rationally, urine should drain freely without obstruction. Placing catheter under extremities can result in obstruction as the compression of tubing from client's weight. When client is on one side facing away from system, catheter should not be placed over upper thigh. This forces urine to drain uphill. Wash hands reduces spread infections. After that, palpate bladder and ask if client remains uncomfortable. Retirements of detention is relieved. Observe character and amount of urine in drainage system determines if urine is flowing adequately. Lastly, record type and size of catheter inserted, amount of fluid used to inflate balloon, characteristics of urine, amount of urine. Rationally communicates pertinent information to all members of healthcare team. Evaluation, residual urine measured, sterile urine specimen obtained, catheterization performed using sterile techniques, retention catheter inserted without difficulty, bladder emptied when patient is unable to avoid.